You probably have heard about precision medicine, and you probably wondered, what does it mean that medicine is becoming precise? Today we are going to take a look at what precision medicine is from a healthcare system perspective. And I hope that doesn't sound too boring, because I promise you it's not. First of all, precision medicine is personalized medicine. It's all about making medicine based around the paradigm of N of 1. So what does that mean? It means you are a special case. You are the only case of you unless you have an identical twin. This is not how medicine is being practiced today. Today, medicine is based on averages, right? What should your cholesterol be? What should your preventative screening algorithms look like? What is the average dose of medication that we recommend for you? All of that is an N of 1,000,000 or 100,000 or 1,000 average patients. Now we know that that doesn't work for most patients in all instances, right? So we know that medication dosage, for example, should be personalized. We know through pharmacogenomics that most people should have specific dosages. But right now, medicine can't do that because we only know the averages. When you look at the average number of data points that your old school physician had about you, I always say it was roughly 30, and not more. What do they know? They know your cholesterol, they know your CBC, they know your lipids maybe, they know your age, your gender, they know maybe 2 or 3 of your family members and their medical history, and that's it. It's a handful of data points that medical decisions were made around. Now with the introduction of personalized medicine, and again, one example here is genomics, you increase that number of data points from 30 to 30 million. And I'm saying 30 million, just one example. If you sequence your genome and focus only on the coding regions that are called exome, you get 30 million individual data points that are absolutely individual to you only. There's only one version of these 30 million, that is you. Another one is me. And now we have the cloud systems and intelligence to actually make sense of these 30 million data points and understand you specifically with all, not all, but with a lot of implications on your preventative care, on your treatment, on your drug dosages, and all kinds of things. Besides the vast expansion of potential data points, we also see a different dimension of precision care here and personalized medicine, and that is the medical checkpoints per year. So now you think in a timeline, how often do we even check on you and refresh these data points? Right now, if you're lucky, maybe once a year, your annual physical, which most people don't do, by the way. So for most people, it's probably 0.2. They go to the doctor every 5 years. In the future, in some instances, this feature is already available today. This goes from 1 to 52, once a week. Once a week, a cloud system should check on you, should check on your blood sugar, right, on your lipids, on all kinds of things, and update your medical record on a timeline, because we're not static, we are continuously changing, and precision medicine should understand how this timeline looks like and how the metrics look like. So in other words, every patient is unique. We should have comprehensive data, and that means 1,000,000 times and more the amount of data we have right now. And it's about maximizing the area under the curve on the timeline of each patient. So you create a continuous protective web of intelligence across time that understands you on a much higher resolution. And this is not fantasy. For many of these data points and timelines and areas under the curve, we already have a ton of clinical and medical implications that are known and validated and guideline imprinted. So we already know what to do with a lot of this data, but the data is missing, unfortunately. Precision data also unlocks the age of medical intelligence. So you've probably heard of AI, but AI can't do much without data. And so precision data that we collect here unlocks totally new capabilities medically. To give you one example, we have 36 million publications currently available in medicine on PubMed and other places. Now, how much of those 36 million publications across all areas of medicine are in the brain, actively uploaded and ready to deploy of your physician? The answer is maybe to 1, 2, 3, 4, 5, but not 36 million. Now with new cloud systems and AI systems, at any point in time, your data, these millions of data points we just talked about, could be live connected to these 36 million publications, telling you with an unprecedented and unparalleled level of comprehensiveness what is going on with you and how we keep you safe. So connecting the 36 million publications and every additional publication that comes online each day with your 30 million plus data points creates a level of intelligence, medical intelligence, that right now only few people can imagine. And as part of that big new intelligence cloud that gets unlocked through precision data is also that we move from one single MD brain, doctor brain that watches over you, to all doctor brains watching over you. Because now we can live connect and real-time connect you based on these data points and insights to the right experts who can actually help you stay healthy or get healthy. Which also you probably know how important that is. Now, some numbers how precision medicine and intelligent precision medicine can actually save millions of lives. Let's start with just a random pick I have here. Pharmacogenomics and the prevention of drug-induced side effects. 14% of patients have experienced serious side effects in the last 5 years in the United States. 14% of all people who are patients have experienced serious side effects, which means lasting damage to your health. Now, if we would deploy genetics, pharmacogenomics, we could bring down that below 1%. If you ever had serious side effects, which includes death, by the way, serious side effects on medications, and that includes probably people, who can be very sick. This can be chemotherapy, targeted therapy with cancer patients, can be diabetes patients, can be cardiovascular patients in real emergency situations where side effects kill. Bringing down that number from 14% of the patient population, which is tens of millions of people, by the way, to under 1% is dramatic. And this is just one example out of many medication side effects. But through genomics, this can change dramatically. Now, beyond the genomics and pharmacogenomics example here, the estimate is that 400,000 cancer deaths per year, which is 2/3 of all cancer deaths, are preventable through precision prevention. If we would have comprehensive precision screenings for all patients each year over 40, this number is achievable. 400,000 American deaths could be avoided just through precision medicine. And so when you think about these numbers, this is absolutely staggering. That is more than the total casualties of World War II on the American side that we could avoid every single year. And all it takes is more intelligent precision medicine. Now, how do we get there? One of the key drivers, and I mentioned that already a few times here, of precision medicine is genomics. Not because genomics is the only piece of precision medicine. There's also imaging involved. There's AI involved. There's a bunch of other continuous timeline data point collection methods involved. But genomics is a key driver. And why? Because the average medical record of a patient in the United States currently has roughly 217,000 data points if you count every single entry piece in a medical record. Of course, that's not the number of data points a physician actually knows about, but that's what's in the cloud systems. Now, if you apply genomics to that patient, you're increasing the total number of data points to 30 million just through a whole exome. 30 million individual nucleotides that you are counting. That represents an increase in the amount of data per patient of 130 times, 130x. Why is this so important? Because precision medicine is all about a paradigm shift for the doctor and the hospitals. That they go away from an analog perspective of the doctor just looking at you and having some gut feelings about stuff and recalling their old knowledge, into a medical intelligence-centered cloud system that takes in much more data. Now, technically, you could already do a lot with these 217,000 data points, but it's not being done. And why? Because they still allow the hospital to have some inertia and, get stuck in the past. Once you inject genomics into the equation, they have no other choice than really investing and expanding cloud and AI systems, because you just simply cannot handle this data otherwise. And that creates what I call a transformation vector in healthcare that forces the healthcare providers and physicians to, familiarize themselves with advanced medical intelligence. And by doing so, you suck in the other 217,000 data points across non-genomics dimensions. So this is the key about genomics, that they become a transformational vector for healthcare to, beef up their game and catch up to modern times. And once that transformation is starting, and once hospital systems, the centers of care and the points of care for patients and physicians are forced into embracing that new era of medical intelligence, from genomics to other cloud systems and to, automated intelligence guiding systems. Once they do that, they're being forced to transition from real estate companies, which they're effectively today. They're real estate companies that just lease out their spaces to physicians and labs, to innovation cores that are data-driven and generate real value for patients and, for markets, because they understand data and outcome. And in my, worldview, there's basically 1,000 mid to large hospitals globally that cover roughly 1 billion patients, with roughly $10 trillion in annual turnover. That is kind of the economy we're looking at that will drive that transformation. And these, mid to large scale hospitals, they will become the drivers of all medical innovation, which they are currently not. Currently, it's pharma, biotech, diagnostics outside these hospitals. But decentralization and a change in the data and genomics infrastructure will shift and push these hospitals into the center of actual medical care innovation, and will make them the stewards of medical intelligence and data. And in conjunction with that trend and with that transformation, medical intelligence will also unlock full-scale value-based care. So in case you haven't heard of value-based care, the idea here is that healthcare is a very complex system. And what happened so far is that physicians were reimbursed or paid for delivering certain services, right? They conducted a certain thing or ordered a specific test, and then you pay for the test or the thing. Value-based care changes that and tries to understand systemically, what did the doctor do and what are the changes and outcomes, and did the patient actually get healthy? And the payments to the system are based on the value delivered to the patient, which is very complex, as you can imagine, because imagine you're a physician, you conduct a certain investigation in a patient and you order a bunch of tests, and you're not getting paid for that. You're getting paid for the patient becoming healthy again. So that needs to be captured and measured. All your measures need to be anticipated, and all the costs you incurred here need to be anticipated and put into that equation. So it's a big, big paradigm in healthcare that we want to have value-based care, but the infrastructure and the intelligence infrastructure to actually unlock value-based care is missing. And precision medicine is that infrastructure. And precision medicine and a vast amount of data and the connected cloud systems and intelligence systems make it actually possible to understand the value you delivered. And right now, 44% of physicians lack any technology for value-based care. That's what they're saying. They say, like, you want to pay me by value, but you can't even measure the value, so how does this work? 73% of all physicians in the United States say there is no artificial intelligence being deployed in their organization today, which is completely crazy. And that tells you how much has to happen here. And of course, in conjunction with that, 0% of hospitals currently have real-time value-based intelligence. And what I mean with that is, if you're a hospital, you want to see in real time a dashboard. You can click on certain things and see, okay, how am I doing today or this week or this month? How much value in dollars and in lives saved have my physicians created? and what are in real time the value chains of care that have led there. It's very easy to imagine how this looks like, but 0% of hospitals have it. That is very bad, but it also shows you the massive opportunity we are looking here at, and how much has to happen and how much data and intelligence infrastructure has to be built to get there. And all of these medical and financial intelligence systems are based on a singular platform, and that platform is precision medicine. And what is the real big picture power here, to come to the last point? The real transformative paradigm is that value-based care makes healthcare effective. Once you have value-based care that sits on top of the precision medicine data lakes and clouds, healthcare becomes effective. Why is that important? Because right now in the United States alone, roughly $1 trillion is completely wasted. $1 trillion per year is wasted in healthcare in inefficiencies because we don't understand where the value is actually being generated. So we can't push the levers to increase efficiency. And that represents 25% of healthcare spend that is completely wasted. Now, if you're not an economist and you're not too much into all these numbers, I tell you one thing why this matters. 25% of healthcare spend is wasted. If you would spend these 25% on research and innovation that creates the future drugs, the future preventative care and precision systems that save hundreds of thousands of lives, you could increase your spending on research and development and innovation in the United States by 16 times. It's 1,600%. That's crazy. That would unlock the greatest era of innovation you have ever seen. And it would cost net zero because you're saving all the waste here and spending it on innovation. And by doing so, we would unlock an era of innovation that makes medical intelligence and medical intelligence-based healthcare accessible to all 8 billion humans. So I hope that was helpful and gives you an insight why precision medicine is so important, why it's so transformative for patients to deliver targeted therapies to cancer patients, to all kinds of different disciplines, but also transform preventative care, and how precision medicine forms the foundation of value-based care, and how value-based care forms the foundation of the future of medicine and healthcare.